This product, Taron Forte, contains iron, vitamin C, vitamin B12, and folic acid. It is used to treat or prevent a lack of these nutrients, which may occur in certain health conditions such as anemia, pregnancy, poor diet, or surgery recovery. Iron is important for producing red blood cells, while vitamin C helps the body absorb iron from the stomach. Vitamin B12 is crucial for normal blood, cells, and nerves, and folic acid is necessary for forming healthy cells, especially red blood cells. Women of childbearing age should maintain adequate amounts of folic acid through diet or supplements to prevent spinal cord birth defects. The recommended daily dosage for Taron Forte is typically 1 tablet daily, and it is best to take it with a meal to help with absorption. When taking Taron Forte, it's important to follow the directions on the product package. Typically, it is taken by mouth once daily, either on an empty stomach 1 hour before or 2 hours after meals. If you experience stomach upset, you can take it with food, but avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can decrease its effectiveness. Be sure to take Taron Forte with a full glass of water unless directed otherwise by your doctor, and avoid lying down for at least 10 minutes after taking it. If you are using the liquid form, carefully measure the dose using a special measuring device and mix it with water or juice to prevent staining the teeth. If you are taking extended-release capsules, swallow them whole and do not crush or chew them. It's important to use Taron Forte regularly to get the most benefit from it, so try to take it at the same time each day. If you experience constipation, diarrhea, or upset stomach while taking Taron Forte, don't worry. These effects are usually temporary and may go away as your body adjusts to the medication. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist right away. Taking Taron Forte may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Many people using Taron Forte do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, make sure to contact your doctor or pharmacist. As always, if you have any concerns about the side effects of Taron Forte, be sure to talk to your doctor or pharmacist. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years. Keep Taron Forte out of reach of children. If overdose does occur, get medical help right away or call a poison control center. Taron Forte is used to treat or prevent low iron levels in the body. It is commonly used by people who have anemia or are at risk of developing anemia. This medication is usually taken once daily, with or without food. The recommended dosage will depend on your individual needs and medical condition. It is important to take Taron Forte at the same time each day to maintain a consistent level of iron in your body. If you have trouble remembering to take it, try setting a daily alarm or reminder. Before taking Taron Forte, it's important to let your doctor or pharmacist know about any allergies you may have to its ingredients. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have certain metabolic disorders, a history of alcohol use or abuse, stomach or intestinal problems, or vitamin B12 deficiency. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Taron Forte should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. For those who are breastfeeding, it's important to consult your doctor before using Taron Forte, as this medication can pass into breast milk. Now let's talk about the uses of Taron Forte. It is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. It is also used to support the immune system, improve iron absorption, and maintain healthy skin. The recommended daily dosage for adults is usually 1 tablet taken by mouth with or without food. It is best to take it at the same time every day. Remember to follow your doctor's instructions carefully. As for drug interactions, Taron Forte may interact with certain anti-seizure drugs, bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. They can help you find a dosing schedule that will work with all your medications. Also, be aware that this medication may interfere with certain lab tests, so make sure to inform the lab personnel and all your doctors that you are using Taron Forte. If someone has taken too much Taron Forte and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or reaching out to a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Taron Forte for you, it's important not to share it with others. Your doctor may also recommend lab or medical tests while you are taking this product, such as a complete blood count or checking your vitamin B12 levels. It's important to keep all medical and lab appointments and consult your doctor for more details. There are many iron supplement products available, some with a prescription and some without. Some brands contain ingredients that might help your body absorb more iron or decrease side effects. If you have questions about available iron supplements or their ingredients, it's important to consult your doctor or pharmacist. Taron Forte is not a substitute for a proper diet, so it's important to maintain a well-balanced diet. Foods rich in iron include beans, nuts, asparagus, oatmeal, red meat, dried peaches, and pork liver. B vitamins, including folic acid, are naturally found in leafy greens and other vegetables, meat, fish, poultry, and enriched breads/cereals. Make sure to take Taron Forte as directed by your doctor and follow their recommendations for the best time to take it and the daily dosage. If you forget to take a dose of Taron Forte, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Taron Forte, it's important to note that different brands of this medication may have different storage needs. Be sure to check the product package for specific instructions on how to store your brand, or simply ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets to ensure their safety. It's crucial not to dispose of Taron Forte by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the product reaches its expiration date or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.